This is Bringing Better Health to Life, a program brought to you by Conway Medical Center. And my guest is Dr. Camille Sabbagh, and her practice is Center of OBGYN here in Conway. And first, let's talk about you. Tell me about you and how you got to the Conway area.
Well, I'm originally from Montreal, Quebec, Canada, and I came to the United States in 1994 and moved to Conway in 1996, and I've been here since then. I've opened my own practice in 1997, so I've been here quite a bit now.
I've heard from a lot of your patients how wonderful you are, how down to earth you are, how you laugh with your patients, and I guess it's important to make them relax from the moment they're first there with you.
Oh yes, definitely. You know, gynecology is always a time when women are, the first thing they say is, this is the worst day of the year when I have to come and see my gynecologist. So we start from there and we start joking, and it helps. Did
you remind them that you feel the same way when you see a gynecologist?
Yes, sometimes I do.
Well, let's talk about the things that you do in your practice before we talk about the topic of menopause.
Well, I do a lot of obstetrics, young pregnancies, young moms, and high-risk pregnancies. This is a very high-risk area for obstetrics in general. We have a lot of complications in pregnancy, so the patients really need somebody who's going to be there for them and watch them from the first part of the pregnancy to the delivery.
At what age do you recommend that a woman first see a gynecologist?
That's a very good question, because actually the movement now is to start having a pap smear only after age 21, when they used to say 18, and now it's 21 or 3 years after the first sexual activity. So depending on the situation, that would be the time for the pap smear. But the first gynecological exam would be when the young woman is starting seriously to consider having a serious boyfriend and may become sexually active. That would be the best time.
And sadly, we all know that that's usually the case younger than it used to be, but certainly seeing the gynecologist is very, very important, if nothing more, birth control.
Oh yes, and counseling on sexually transmitted diseases, and especially protection, using condoms when they have intercourse. Even if they're on birth control, they sometimes forget that they still have to use protection, and especially the younger teenagers, if you like, they don't always use condoms, or they might use it the first month, but after that they feel comfortable and they don't use it anymore, and that's a big problem, because they usually have several partners over a period of a few years.
And I'm sure there are parents still today who fail to talk to their children about these things,
yes,
and they leave it up to the gynecologist.
Exactly, and a lot of parents don't have a lot of information themselves, so it's difficult for them to give them the right information. So it's a good idea to come and talk with us.
You're here today to primarily talk about menopause, and I could certainly talk about this blindfolded, having lived it and still living through it right now. But menopause is different for everyone, and it hits people at different ages.
Yes, definitely, because you can have the normal biological menopause, if you like, where it's about 51, 52 years old. But a lot of women who've had surgery and removal of their ovaries may become menopausal a lot younger, in their early 40s, or sometimes even in the 30s. And it's very important that they have regular follow-up and that they have hormone replacement therapy. And that has to be discussed, because there's a lot of pros and cons. As you know, there's a lot of controversy. Every 5 years they give us different information and different direction to go. You know, sometimes they're good, sometimes they're bad, so you have to discuss all this with the patients. And each patient is different. Each patient has to be treated as a different case.
Now, I know there's probably a lot of women who come to you and they don't even know what's wrong with them. Perhaps there's someone like me whose mother never had menopause, never saw it in my family, and then all of a sudden I was hit with horrible hot flashes and mood swings. So so many illnesses are hereditary, but menopause doesn't seem to fall that way, does it?
No, different people have different symptoms, and you can see it even in the same family. You know, you have several sisters, and one will take hormones and the other one can't for another medical condition, and the third one will take it but only for a short period. So you have to always treat each patient individually and evaluate the risk factors for each one.
So when you sit people down, do a lot of people today just say, Dr. Sabbagh, I don't want to take anything unless it's all natural? I mean, there's so many people now who are fearful of hormones,
Yes.
but yet they work for a lot of people.
Well, what I tell them is I say to them, I say, you are a woman. You've been with hormones all your life. So this is a normal thing for you. And all we do after menopause is replace what you need. We're not giving you the same level of hormones that you had before. We're just giving you what you need to avoid complications of menopause, which one of them is the osteoporosis later in life. And that's very important because women live a lot longer. As you know, they live longer than men. And the age expectancy now is in the late 80s, 84, 86 years old for a woman. She's menopausal at 52. She'll have serious osteoporosis in her 70s and 80s, and we need to prevent that.
Now don't go away, because when we come back, we're going to continue our conversation about menopause and osteoporosis right here on Bringing Better Health to Life.
The Conway Medical Center website provides visitors with a comprehensive resource for their health and wellness inquiries. From our homepage, just click onto Search Health Topics for direct access to the HealthWise knowledge base, where you'll find over 5,000 topics about health conditions, medical tests and procedures, medications, support groups, and everyday health and wellness issues. At Conway Medical Center, we know that better informed patients make better health decisions.
For over 50 years, it's been our mission at Garden City Furniture to offer our customers quality home furnishings at an excellent value and to provide personalized service that is second to none. You'll feel at home at Garden City Furniture on 17 Business in Garden City.
We're in the middle of a conversation with Dr. Camille Sabbagh, and her practice is the Center of OBGYN here in Conway, and we're talking about menopause. What are some of the symptoms? Because they vary with everyone.
Well, definitely. Most women will complain of hot flashes, night sweats. That's the major complaint. However, there are other symptoms that I find are also important, but that we hear less about, and those are called the genitourinary symptoms. Basically, increased risk of urinary tract infections, and also genital atrophy, which leads to a thinning of the lining of the vagina and the vulva, and leads to difficulties with intercourse. And surprisingly, when there was a scare, as you know, with the hormones a few years back with the World Health Initiative study, and a lot of patients stopped their hormones. And not all women experience hot flashes, so some were fine for a few months, and then they started having a lot of difficulties having intercourse with their husbands. And it was the husband who told them, you need to call your doctor, there's something wrong with you. And come to find out, it was the lack of hormones, which they underestimated the consequences of stopping the hormones. And oftentimes, if a patient becomes menopausal and she lacks the problem or doesn't have the problem of hot flashes and night sweats, I will inquire about the genitourinary problem. And if she needs hormones, I will tell her, you need to take them at least for the time that you plan to be sexually active, and then you can move on to other options. For example, the biphosphonates, which I'm sure you've heard of, the Fosamax and Actonel and those medications, which are very good for osteoporosis, but don't do anything for your body physically. The hormones tend to make you look younger, feel younger, and helps with the mood. whereas the biphosphonates have nothing to do with that. They're just plain medication to help with reducing the risk of fracture of the bones.
You mentioned osteo, and when people connect osteo as a personal illness, they think about, oh, I better take more calcium, I better buff up on my vitamin D. Your thoughts on that, Camille?
Well, it all works together. The hormones help to send the calcium to the bone to increase the strength of the bone. But the absorption of calcium is dependent on vitamin D. The absorption of calcium is in the intestinal tract, and if you don't have enough vitamin D, which actually a lot of women past menopause do not, then the absorption is limited. So therefore, even though you're taking your calcium, if you don't have vitamin D, it's not well absorbed and therefore won't be sent to the bone, and the whole process is slowed down so that your hormones are not working as well as they should.
That's amazing. I've never even heard that. That's fascinating.
Mm-hmm. And the new findings about vitamin D is that they reduce the risk of cancer, breast cancer, colon cancer, lung cancer, and in men, prostate gland cancer. So that's a very important finding, and we now realize that in women who have limited their exposure to the sun, because the vitamin D is produced from on the skin when it's exposed to the sun, the UVB rays produce the vitamin D, which is then absorbed and will work in your body. But a lot of women don't go in the sun anymore because of the risk of skin cancer, or they will go in but use a strong sun protection cream. So because of that, you have less exposure to the sun, less vitamin D is produced, and you need to have some supplements.
Which is why you should see your gynecologist regularly so she can stay on top of this. Well, I hate we're out of time because I was really enjoying the conversation, but Dr. Camille Sabbagh, thank you so much for being with us here.
Thank you. Thank you very much.